My name is Jeremy Slosberg. I'm a pediatrician, and I've been in practice since 2019. What I really like about pediatrics is the variety that we get to see, that we, in the same morning, you'll even take care of young babies who are perfectly healthy and just coming in for their vaccines and to check in on how they're doing. Then you also get to see sick visits, and you also get to see adolescents, and they're all technically kids, but they're completely different fields. And so I think the variety keeps things really interesting. In general, I try to be really collaborative with families. I find that although I may have a particular way that I would recommend doing something, that way may not necessarily be the right answer for every family. And so whenever it's possible, I try to give families different options and try to talk about the risks and benefits of different approaches, and then help them make the decision that makes the most sense for them. Each area within pediatrics has its own aspects that I find really interesting. In particular, I think adolescent visits can be really interesting. I think adolescents have a lot to offer as they're becoming full-fledged adults, and sometimes that transition period can be really difficult, and I think there's a lot that we can do to help adolescents with that transition. I also really like working with kids with complex medical illnesses. I find that oftentimes there's a lot that we have to offer as pediatricians, not just with the medical aspect of it, but with the navigation of health systems that unfortunately sometimes can be really confusing to navigate. And so I feel like there's a lot of work that can be done to help families there.